In the US, it says like 13 to 20 minutes a medical doctor would see its patient. In the UK, it's 10 minutes.
It's true that we are in a system created so that it's this way.
Only about 50% of doctors would implement like some holistic therapies today into their practice, or recommend it at least.
When I started to become a family doctor, at first 30 minutes. I was working at the government. It was even shorter. 7-10 minutes.
So you would only see 7 to 10 minutes a patient.
I was feeling deeply in my heart. I could not sustain it for long. I had to change the method. I have sessions of 1 hour, 2 hours.
I mean, some people may think now, what do you do for 2 hours with the patient?
Many times my patient, they say, thank you to be so clear. I'm investing in long term. This reminds me of a story of a patient. It was 2 years ago. She came desperate. So I told her,
welcome to the Living a Life in Balance podcast. My name is Abdullah Boulad. I'm the founder and CEO of the Balance Rehab Clinic. My guest today is Dr. Indhira Ghyssaert, general practitioner, nutritionist, and expert in integrative medicine. In this episode, we dive into why all doctors should be nutritionists, the importance of individualized care, and the advanced assessments that reveal the real story behind your stress, gut health, and hormonal levels. You'll learn about a variety of men's and women's health issues, including PMS, PMDD, PCOS, and the rising rates of erectile dysfunction and testosterone decline in men. We also unpack some of the biggest myths in nutrition and longevity, from misunderstood supplements to anti-aging, quick fixes, and explore what actually works when it comes to restoring biochemical balance and long-term health. I hope you will enjoy. Indhira?
Abdullah, hello.
What motivated you to do what you do today?
So to become a doctor, it's a long story. It started when I was 6 years old. And I remember it was like a challenge with my older brother. And he said, I want to become a surgeon. And then I had to reply something. And it came to my heart, I want to become a family doctor. And it was really like a big mission revelation, no? Mm-hmm. And it stays like this for years. And we were like always like in competition. And but at the end, he didn't become a surgeon, but he has a beautiful profession also, which is also like a kind of lifestyle coach and training. And that was really important for him also to become like this. And then at the end, when I was studying medicine, I also wanted to become a surgeon at a point, but then I decided to become a family doctor, because I was thinking, if I become a surgeon, will I be able to connect with the patient? And I really needed this connection. I really needed to feel that I was helping the person that I was going to assess and see and meet. And I'm super happy with the choice. Actually, it's so beautiful. Every experience, every patient is a new encounter, a new challenge for me, because they come with specific needs. And it's really beautiful to be able, like an artist, to look at all their story, all their medication, all their symptoms, and then bring up solutions and what tests to do. And it's really, I'm so happy, so glad to have choice to be a doctor. Mm-hmm. Yes.
So your motivation was to help others, to help people?
Actually, yes. I think I really want to help people, even nowadays, like every day that I go out of my house and then I come back at my place with a big smile. I really feel my day has been helpful. My day has been fulfilled by the patient's like happiness about what we are doing, the treatments, and all this brings me a lot of happiness, but also challenges, because it pushed me. Sometimes I'm also like re-questioning, okay, for this, what should I still look at, which studies, what is new. So it's also like a kind of always something new, always something relevant to look at. So it really brings me always a lot of joy also to just be passionate about what I'm doing. So I'm very happy to have this as a job. It's really relevant, and I think I will be always passionate. I was telling to my husband, even one day I don't even need it. I really would like to continue to work as a doctor, because I think that's really something that brings so much light to my life, and so much, how to say, when you see someone life changing because you bring up a solution, and that it really upgrades his day-to-day life, his comfort from one place to another place, and that they are so grateful for what you have been doing for them. And this is incomparable. It's just so beautiful.
It's a nice calling.
Yes.
Well, how old have you been when you had this feeling you wanted to be a doctor? Was it a young age?
It was young age, yes. When I was 6 years old. Of course, when you grew up, you always want to go like then an actress or a singer, like I think any girls that have like dreams in the head. But then I was thinking, okay, what is a profession that I will be able to do from all my life? And I remember when I was a teenager and I was at the high school, and my friends were telling me, are you going to be crazy to be studying for 10 years? And it's your best, like, kind of years of life, they were telling me. And I was like thinking, and then it's true that at a point when I was finishing high school, I had a bit of doubts. And also my father and my sister was not super like encouraging me throughout this direction, because they were also telling me that it could be a difficult life, because of course it's a lot of hours, like studying and at hospital and for the praxis. And it's true, it was. But then I decided, okay, if I'm not sustained at that point, I also love to study nutrition. I'm super passionate about food. And as Hippocrates says, the food is our first medicine. And every of our cells are built up of what we are eating. So, of course, that was a big inspiration for me to start to study nutrition. So I dedicated 3 years only studying nutrition, university degree. And this was in the south of France. And this was really, really so key for me to have this tool to understand, because then I said, okay, no, I really want to study medicine. I think it's not enough to help people at a point. I was feeling also limited by just giving nutrition assessments. I said, okay, no, let's do my first choice, which was medicine, and let's use nutrition still inside. And when I was studying medicine during the 10 years, like between the main 7 years and then the specialty, there was almost no course of nutrition. We had like about maximum few hours about it. Yeah. So, of course, I was feeling that it was a lack in the university, like medical curriculum. I think would have been good to have a bit more. But I'm so happy to have it done by my own, because I think after 10 years medicine, I think it's difficult to say, okay, now I still study 3 more years just nutrition. So I'm happy to have it done at the beginning. This was really a good moment, a good timing for myself. And this gives me a big understanding also of the vitamins, of the biochemistry, of what's happening inside of the body, of how the vitamins are impacting in our body, of how our body is such a big laboratory, building up molecules and building up proteins with little pieces that we are digesting from our food. So everything comes from our food, of course, and also the genes of our body that then decide what to build up and what we need. So it's incredible. It's so amazing, the biochemistry that's happening inside of us. We are a big lab at any moment, and we are not even aware of these billions of reactions happening any moment. And this is what brings the balance that should be there in the body.
I found it very interesting that you were trained initially in nutrition and then chose medicine. It gave you a good foundation for going forward. Can this be categorized as nutrition is something you do something to yourself on a preventative basis, whereas medicine historically and now in the past was more like treating the illness?
Medicine has been dedicated to be more directed towards diseases. Although the first 3 years are also dedicated like to bases and biochemistry and physics and mathematics. Then when we go into the masters, it's all dedicated to disease and what are the symptoms and how to treat it, which is super important, super key. Because of course, when the patient comes and he's feeling sick, and in an acute moment, it's really needed to have clear ideas of what's going on and how to deal with the symptoms and how to help the patient in the moment. But then I really feel that the nutrition helps in terms of maybe preventing more disease to happen, because when we know that for the diabetes type 2, the nutrition is so important, but also like when we have hypercholesterol or hypertension or heart problems, it's true that there is always like also a genetic component, but also lifestyle is so important for all these disease, this chronic disease to be prevented. And I think the prevention part of the disease has a big place and should be taken in consideration, as so many studies and so many guidelines talk about these lifestyles and how we can prevent it. And also in my last master of diabetes, it's also reflecting so much. So I think it should be more taken in consideration, of course, yes.
So I understand you mentioned now more studies you have been doing.
Yes.
So you started with nutrition, then become a medical doctor, and then also some further specialization.
Yes, I did this master in diabetes type 2, which I really loved, because it gave me a total different aspect of how to treat the diabetes type 2, not only with medication, how to also maybe increase medication when it's needed or decrease the medication when the patient is also increasing his physical activity, increasing his better nutritional plan. And all this was really key for me to understand, okay, so lifestyle is super important, super key. And let's apply it also to different patients and different pathologies and look at it in a more detailed and more more specialized way. And actually, I see it all the time when I'm looking to articles, to new studies, to new guidelines, that for each special disease, there are special guidelines, and they always point out also lifestyles. And after the master of diabetes, I also looked into the supplements, how are the supplements could be used also in general in the practice of a doctor. And I did some special degrees for this that they called special nutrition active for the cell. So that was super interesting for me to start with, and to understand also the implication of some micronutrients, how they could help also to rebalance the body when they have specific symptoms, and not only going directly to medication that could have maybe side effects, but say, okay, let's have a bit of overview and maybe take a different path and see maybe if this helps, because it also, there is more and more studies about supplements. And of course, we are at the beginning. And the more we will move forward, the more we will have studies. And with more time, we will have, of course, more strength in the scientific part. But I think the experience of the professional that is applying all this is also super important.
I always consider also medicine as something lifelong learning. You definitely do your initial studies in nutrition and become a medical doctor, a family physician.
I agree. Yes.
But you have to stay on top of the latest research. You have to follow up annually on what has been published with new studies, and beside your own experience, I assume. What do you do in your annual daily life to stay up to date with what's happening out there?
So I love to look at what are the best resource, because I'm really also very exigent regarding which studies I look at. And for example, I love also the resource of the Medical Harvard School. Mm-hmm. And they are now publishing and putting available on their webpage different topics. There is a full page of different subtitles and topics where you can just download it. Mm. Of course, you have to pay for it, but I think it's so worth for what they offer. Mm. And they have also formation, what they give. And I've been applying to one and listening to the presentation. And also they give reference as books that I love. Like, for example, the book of Dr. Willett called Eat, Drink, and Be Healthy. Mm-hmm. He's an eminence into nutritional field. So, of course, I'm a super fan. And I love his book. He's so professional, gives so much good input with studies. And also, he even takes the time to say which studies are the stronger, so that we really start all from the same basis. And it really reminds me of my statistic courses in medicine, where we were learning which studies are the best, also to take in consideration. Mm. And of course, I like to also to go in PubMed, which is one library where the doctors, where it's published new investigation about, it could be supplements, it could be vitamins, it could be anything about any disease. And of course, these studies, they are one who has more strength than others, but it's always good to keep updated. But I remember in December, I had one patient that came to see me, and he just got a diverticulitis crisis and was hospitalized, and then came back to me after the crisis when it was all more stabilized, but was still asking for resources because it wasn't very clear. And it's true, I looked to all the news, all the updates, and still I'm formed into nutrition and I know the diet for diverticulosis and so on. And it was tricky because some were saying one thing, then others. And then I was looking even podcasts, even nutritionists doing podcasts about it. And I finally found that even though the studies say, you could eat again more seeds and so on, no. Then it was a presentation of a nutritionist saying that no, his experience showed that still we have to be super careful about the seeds because they could create, again, a diverticulosis. And so we have always to be careful about these studies also. Yes. Because one thing is the study and one thing is the experience. Mm-hmm. And the experience is super important. In EBM medicine, evidence-based medicine, the experience has a big, big role to play. Mm. And of course, always we are 100% following the guidelines, the studies, but also the experience and also the experience of the patient. And each case scenario is different. And we have to adjust because, of course, each person, each individual is so unique. That's nice that you go deeper and the patient can motivate you also to dive deeper in a topic to understand it better and provide the best thing you can do. But this is pretty much not the standard out there with family doctors or family physicians. What do you see the role of a family doctor today? Oh, I think it's so key. It's so beautiful. We have the opportunity to see the person in his globality. The only thing that is tricky is the time, which time we will dedicate to it. Mm-hmm. And when I started to become a family doctor, I had first 30 minutes. My mentor was super kind to me and said, okay, you are just starting, so 30 minutes per patient. I was really happy, but still I was thinking, oh, it's so short. And then he said, okay, now after 6 months, he said, okay, we are now have to put it to 20 minutes, and because this is what you have to accomplish. And it was in Belgium and in Brussels, and I was thinking, okay, 20 minutes, let's make it. But it was really, really tough. And then when I moved to Spain eight years ago, and I was working at the government, it was even shorter, like 7-10 minutes. It was like very, very short per patient.
So you would only see 7 to 10 minutes a patient?
Yes. So it was really, really a short time. And so I was feeling deeply in my heart, with my intuition as a doctor, that I could not sustain it for long. I had to change the method, because knowing about nutrition, knowing how the nutrition impacts on the health as a nutritionist, knowing more and more about the supplements, knowing more and more about what tests can be done, what are the different symptoms, and also sometimes there are complex cases with different pathologies, not just one, but few. I was thinking we need to do something about the timing that helps us to go deeper into each case scenario, so we can find a root cause of why he's having these symptoms, and find maybe a proper solution that will not hook us to a medication for long term, because this medication, of course, they are super good when we want to treat acute, and I think it's beautiful. But for long term, if we want to find a solution long term, and also make the patient independent of some medication and just bring him back to a normal state, then we have to think also in terms of lifestyle, and also a proper guidance towards lifestyle. And I think this is like almost a new specialization that should be given and taken place to prevent also, because prevention could be like a total new field. Also, although it already exists, but I think it could be even increased.
I've been often thinking lately about this topic, because is it really the medical doctor's responsibility to be that person to help their patients with referring to other therapists, holistic therapists, or is it another specialization which is needed? And because the doctor, as you said, may train 10 years, maybe this is too much of a qualified person to do so. But certainly, I mean, I have been looking also some numbers, and it's in the US, it says like 13 to 20 minutes in average a medical doctor would see its patient. In the UK, it's 10 minutes. In the Western world, the highest number has Sweden with about 22 minutes, which is nothing. You cannot help holistically, but that's the pressure most likely given by the environment or the insurances and the pressure to see more patients throughout the day.
I agree totally with you. It's true that we are in a system where it has been like created so that it's this way. But I think that, of course, we can always think in terms of health coach. But what I've seen with health coach, because I have patients that have been doing this, at the end, because they don't have also this this overview in this scientific field as we have as a doctor, I think they are still limited. Although I think that each apportation is key, because sometimes the patient needs to hear it a few times. But also in the medical field and the figure of the doctor, it has an impact. When you do a motivational interview with the patient with this background, it has a big impact. And studies show it, that the patient really, if there is also this connection, this relationship, professional relationship in between the patient and the doctor, and also this trust in between the patient and the doctor about telling certain symptoms that can be also very intimate. And maybe they don't want to share it with a coach. Or maybe a coach cannot understand already a medication that the patient is taking, because he needs this training as a physician. I really think that it's so complex. It's so complex. Although I really appreciate all these works that other person are doing as coach, because we can hear it one time, two times, and sometimes also we cannot offer, or we don't have the time to always go to see a doctor, or maybe there is no possibility. I heard in Canada to see a doctor is so tough. Few of my patients coming from there, they say you have to wait 6 months.
Yeah.
So it's also this, what is the availability of this professional? Are they giving some availability for this? Are they putting their emphasis to this? I think it's about also like, what do you want to offer? Which direction you want to take? What is yes?
Yeah, this is in line with some information I was researching. They say like only about 50% of doctors would implement like some holistic therapies today into their practice, or recommend it at least to their patient, which is quite limited given the fact that many diseases or problems, patients would go to the doctor with have lifestyle origin somehow as well. What does it mean to you to be today like holistic and functional medicine, integrative medicine doctor?
I would compare it like, if you have a microscope and you are looking to something close by, so you see the cells, you see what's surrounding the cells. But if you want to look at a body, you have to look at it as a big, beautiful picture. And you need to take a bit one step forward, backwards, and look at it and have time to do it and look at all the aspects. Because the body is like also emotional, but also it has genetic component. It has the medical story of the patient, what happened in the past, what is he suffering now in the present, what is still affecting from the past in the present. Also, what is the family background, because sometimes also the family history gives a lot of information. And also what is his diet, for example, about. Is he taking already supplements or not? All this together, it's a lot of information that is really key to have a big overview and say, okay, from this perspective, now where I go, what tests will I do, what can still be done to help him. He's coming to see me. What can I give as an extra input in his life to bring him where? So all this happens as an holistic doctor. And also, if he's taking medication, can I help maybe to reduce the medication? Do I need to increase it? And all this depending also on the blood test results. So it takes time to see all this. And of course, it's also a choice. And I understand that every doctor does his best. I really think every doctor wants really to help deeply. And it just depends also the way or what you can offer. And I think it's something very personal also. I think it depends of what you decide to offer and which way you want to treat the patient.
How much time do you take on let's say, a first assessment with a patient, and how much time on following sessions, just to get an idea?
So the first session, it's minimum 1 hour. It can be more. And the following session, it depends. I have session of 1 hour, 2 hours, and sometimes more. I have complex situation, and sometimes my patient already have seen like different specialty doctor and feel desperate. So they really need hope. They really need to see that something will help, that probably will bring them in a more comfortable area. Have different stories, like chronic pain or a patient that was triggered by an episode and then couldn't sleep. And we were also working together throughout different therapies. And she was feeling better. And step by step, she could go out of this loop. And I really think my motivation is to give hope and also help them to go out of bad loops, or just maybe just go in a more comfortable also area sometimes.
Yes.
Just upgrade, become a better version also. Sometimes it's not so complex, and they just come for a general checkup, and they just want to see if everything is fine and what they can improve still. So sometimes, it's just about a general checkup. It depends. Each situation is different, and the motivation of why they come is different. But I think in a general way, yes, I need for sure 1 hour, even with simple case scenario, because then I can bring something. I feel I can bring something to them.
Yes. Some people may think now, what do you do for 2 hours with the patient? But I understand how you work. I understand what you do, and it's very important to give also the emotional and mental trust and feeling to the patient, and not just the medicine, and go for it, and the understanding behind it possibly as well.
So for me, sometimes the time flies, I must say. I'm there and I'm so absorbed into what's happening with the patient and explaining him also. I think through explanation, we really bring something to the patient. We make him independent in a sense. We create him the possibility to be his own healer in a certain way. Because when you understand why you are taking a supplement or why you are taking a medication, you will also, in the long term, follow up this assessments that I'm doing, all this counseling, all these advices that I'm giving to them. For me, it's very important that they understand it. So I do a lot of I wouldn't say that it's motivational interview, because I feel it's like really like a flow. I talk to them, I explain them. And what happened is that many times my patient, they say, thank you to be so clear.
Yes.
Thank you to transmit, to make that this knowledge is now mine. Thank you to make me aware of certain things that I wouldn't even think about. And because I explain them everything that I do, I think it takes time, but it's also like I'm investing in long-term empowerment of the patient. Also, of course, I take care of listening to them. I listen a lot to the patient, because I think to listening to the patient, we get a lot of information. Sometimes when we are in a hurry, it's difficult to listen. And the main thing also to build up a relationship with confidence is that the patient feels that he's listened. And I remember when I chose in medicine one of my optional courses that was about motivational interviews. They were saying that there is 2 times, what you say to the patient and what you listen to the patient. And they were saying that many patients, they didn't have even the time to share. And it was just like pam, pam, pam. And of course, we do the part of the job, but maybe he hadn't the time to express himself. And this is also the beauty of having a bit more time, is to be able to have extra information that might be super key to understand maybe certain symptoms or part of the story, or to share then with a colleague of the team, a psychiatrist, a psychologist, or the nutritionist, or the personal trainer that they need to for doing their job. So I think also like it's like a moment when you recollect information, then also to redirect the patient throughout others specialists that he might need. I like to refer to colleagues when it's needed, and to also feel supported by colleagues that are taking part of this emotional part, because of course I don't have the knowledge enough. I'm not a psychiatrist, so I love to be able to also refer to psychiatrists or to psychologists. I'm not a psychotherapist. Of course, I'm also formed into hypnosis, which I use sometimes when I see the patient and he's very anxious or just need to relax, just need to release. It's a very beautiful tool, but I'm always sharing with the psychologist, for example, what I'm doing. And it's not about therapy. I'm not doing a therapy when I'm using this tool. I'm just helping him. For example, lately I used it with a patient that had anxiety because she was going through a difficult period, or with a person that had eating disorder and she didn't want to eat anymore. And then this could help her. I was using it just in a soft way so she could understand me better. And I think this is also a beautiful tool that also takes time to use. And then, of course, the treatments that I give that take time. Yes.
When I've been traveling around the world, and also I have a Middle Eastern background, but I grew up in Switzerland, and I always compare it like in some part of the world, when the doctors have their white robes on, then they are respected, and it's like the patient would just accept, oh yes, it's kind of obeying what they say without questioning what they do. Whereas in Switzerland, Germany, Western Europe, or in the Western world, more the knowledge and the collaboration type of relationship between doctor and patient is more on the rise. How do you see this in your daily practice?
Yes, we talk about it when I was also doing my medical internship, and we were thinking, okay, we were thinking about this paternalistic way to treat the patient, where you give the direction and it's like this and it's like this. And I think nowadays, it might still be applied and still work. Why not? But personally, I think it's so much beautiful when we are in the same page, when we are at the same level, and building up a relationship that just make us even happy to see each other, you know, and where we feel trust and feel that we feel empowered. Yes. And I think really about empowerment of the patient. And I think this is so key for the healing process. If you empower someone and you give him the keys of him also having his responsibility, is giving the responsibility to the patient, his own responsibility, not taking his responsibility.
Yes.
But also telling him, you have your responsibility and you have this power to take your supplement, be careful with your diet, be careful with your mental health, be careful of meditating every day, and you give this power to him. I think this makes a big difference from the long term. And also, I think it's like maybe a more modern way to like interfere and interact with the patient. Yes, I would say yes. But I'm still appreciative with the doctors. It's I think also about the choice of the doctor, how he decides to to treat with his patient, but I think it has to be something that you see with time it's effective and that it's also what the patient needs. Also, maybe it's a part of the culture, that maybe some cultures, they need this paternalistic way, and maybe others, they are happy to go to another style of choosing how to interact with the patient.
Yeah, but I love what you said. You want to empower the patient, so they feel themselves, they can do a change themselves as well, and not just to expect someone telling them what they do in their life.
Exactly.
And I think that's more and more happening. When a patient comes to your practice, when you see them, how does a first assessment look like? Just if you can guide me through this process, what parameters do you look at? What do you test to get the full picture of the medical condition?
Sure. So, of course, I always ask what are the medication they take, the supplements, what are the medical history, what are the family history, if they have allergies or not that I need to know. And then I look all the parameters like blood pressure, saturation, pulse. When it's needed, I also ask for an electrocardiogram. We look also for the blood test. We do also blood tests, of course, but I like to dive deep into what's possible to do with blood tests. Look vitamins, look all the vitamins, A, D, E, K, vitamin C, all the Bs. I like to see the minerals, the selenium, the zinc, the magnesium. I like to see how are the hormones, how is the cortisol level, is the patient stressed, not stressed, how is the homocysteine. It's also a reflection of the stress level. And then depending also on the symptoms of the patient, I always specialize or ask specific tests like intolerance food test or the stool test, the microbiome, urine test, amino acidograms that are the little pieces that permit the body then to build up proteins. And I like also the profile of fatty acid, sorry. And yes, all this together I think gives a good picture. And I like because sometimes I have really good feedbacks about my blood tests. Patients that go back to their countries, come back and say to me, oh, my doctor looked at it, or my specialist looked at it, and they were really astonished. They really love how you did, that they are so amazed about what you tested, that is really complete. And I think that's really the base, because actually if we are lacking of things, how can we produce what we have to produce? If we are low in zinc or low in vitamin C or low in certain amino acids that are essential for the body, because he cannot produce himself.
And such screenings, you always do it the same, like with every patient at any age, or how would you adjust it?
I have a base, because I would say this is really we need to know. And then, depending the symptoms, we can always ask, even for genetic tests. Certain genetic tests I really love to do when I think, okay, this I need to know. And there are different genetic tests, like the MTHFR. How is the tolerance of the gluten? How is the tolerance of lactose? How is the inflammatory response of the body in the genetically wise? And I think these specific tests are also depending what are the symptoms of the patient. Then I decide, okay, I do this or this or this. But I like to have a good base. And also because I think from my nutritional background, I see the importance of each of these micronutrients. Then I say, okay, for my lab, which is the body, I need to know if I have enough of these micronutrients, which are the ingredients of the body to produce the hormones, to produce the protein, to produce the immune system cells, So I think really this is key for good base. But then, of course, we have always a lot of tests, and I love the tests. It's like when you want to cook and you open the fridge and you choose your ingredients, means the same. When I choose my test, it's a bit like this. Regarding, of course, medical background and medical studies and all this reference as guidelines also.
Well, and what about screening, these assessments? How frequent should someone do them?
I would suggest once a year for sure.
At any age or more?
It depends also
from a
how you
certain
feel.
age?
It depends how you feel. Because more than the age, because it could be that there is someone of 70 and he's totally fine. Why not once a year? It could be that someone of 70 is feeling sick or weak, and then I would suggest more frequently. And also it depends which disease. For example, if there is a diabetes, for sure you need to do it every 6 months. And for example, if the patient is feeling better but not 100% better, why not retest certain tests and see what's lacking, and maybe go deeper and more specific in towards whatever is like microbiome test, or there is stool test, there is permeability test about also the health of the gut. There are so many tests to do that sometimes we have to choose, okay, which one we start with also for a certain disease. Because we cannot do 10 tests at the same time. I always say to my patient, okay, let's be smart as if we look at an organigram, and let's say, okay, in the middle, it's what needs to be yes or yes, eradicated as a diagnosis. So let's start with this. And then from that, we start and we do other tests. So it depends also how is the patient at the base, I would say. It's very personal. But yes, if you are in good health, I would suggest once a year. And if not, you have to check with your medical doctor and see what has to be still done.
You mentioned some of parameters you look at, but there is also something with heavy metals and microplastics, and you hear a lot that they affect the brain and the body and cause different diseases. What's your opinion on that? What's their effect, and can they be tested, and how?
So yes, heavy metals, they can be tested. There are different tests that can be done. There is urine test, or also hair mineral test. And what I like from the hair mineral test is that it looks like the 60 days before what happened. So if there was heavy metals or not, how are the minerals, and all this really gives strong information of how to help the patient, because it might be that they have arsenic, or they have nickel, or they have mercury. And of course, I think it has to be retested, of course. It can be affecting the body. It can give also different disease. And it's important to think in terms, okay, we are evolving as a human being, as a human race. We are evolving. The society is evolving. We are interfering with more and more different substances that comes from the day-to-day life or is in the air. So yes, as microplastic. So that should be also tested. So far, I'm not testing it. I haven't found a test testing it here, but I'm super, super happy if there are tests coming that helps to prevent, helps to diagnose, and then that we can also have a solution for it. Because I also like to think, okay, if I test that, what can I bring as a solution? So I think we have also to think in terms of not making extra testing without bringing something. Where I want to go with the test is very important. What I will bring as input after doing this test is for me very, very important. I don't like to test to over-test, but I like to test when I know this will be very key for me to help the patient or to treat something or to prevent something. Yes.
No, makes absolutely sense. Another very exciting and interesting topic is the microbiome, I feel, because we understand in mental health that it has also, it's our second brain, we say, and it causes also I have some numbers, about 61% of people have an imbalance within their microbiome, which causes different types of issues along their life. and without knowing where the origin is. And what could be the cause? And can you explain what is the microbiome in the first place, and how is it connected to the rest of the body, and what it causes?
So the microbiome is all these little bacteria that are living with us in our gut in a day-to-day life. We are not alone.
Sometimes scary.
And they are good bacteria that are doing super good job. They are secreting metabolites that are so important, so key for our nervous system, like vitamin Bs, also like neurotransmitters like GABA, tryptophan, and that we know that, for example, the tryptophan is so key for the secretion of serotonin. We know that the GABA is so important to feel relaxed. And the B vitamins also are so important just to feel relaxed. And also, like, they also secrete like small fatty chains that are really important, for example, for the maintenance of the permeability of this membrane, that this mucosa that is protecting us from that everything goes out, right? It gives a certain, if the permeability is there, this gives also like more comfort, less inflammation. If the permeability is not there, then there is more bloating, more macromolecules that go out, even not digested, that will also inflame the body. So I think the microbiome is really key to maintain a stability of our gut health, of our mental health, of our health in general. And there are ones who say that it's even the first brain. It has more neurons than our own brain. Yes. So in terms of number, it wins for sure. Then, of course, the brain has his own secrets and abilities and also the computer that orchestrates everything. But yes, I love our microbiota. I really want to protect him. I really want to study him. I really think it's key to understand where there is something unbalanced, when there is not enough good bacteria or too much of the bad ones, if we are not secreting enough of the metabolisms that it's needed, how to rebalance it. For example, when we don't have enough butyrate, which is one small chain acid, lipid acid that is needed for this permeability, there are probiotics that have at the same time this butyrate and the probiotics that will produce it, and you take it per mouth and it rebalances, and it really gives a comfort. And it has been shown that, sometimes in the microbiome they say then, it predicts that you could have cardiovascular disease, I think it's linked with the butyrate, because many studies now, they show that the butyrate helps also for a good ratio in between the HDL level and the LDL level. So why not to pay attention also to this detail? If it can help for also a better protection of the cardiovascular system, why not?
I also came across like stool transplantation, and there are a lot of experiments around that,
Yes.
Particularly for different diseases, but also mental health, which I found very interesting, apparently. Like where someone was implanted stool from a brother who was healthy, and she was depressed, but he had acne, and then she became acne as well. So it's quite interesting, fascinating to me what the effect could have, and what on our whole body and on our mental health. And this is all in our gut. Yes,
I agree. It's very interesting to see the potentiality of all these microbiotes that is there, all these bacteria that we never even think about them, but they are there every day. They sleep with us, they drink with us, they eat with us.
Do they sleep?
Yes, I think they must have a rest sometimes. And but yes, I'm also curious about what can be done on the medical parts, in a bigger scale, yes, I would be very, very happy to see it in the future. But so far, I'm doing the use I can with the investigation and the results.
So we are a universe of bacteria and biochemical processes in our body, in our brain, and different parts. What can we do to rebalance? Because we know that kind of every person, if not every second person, or if not every person, has some biochemical imbalances. So what can someone do? How is the process of rebalancing the biochemistry in one's body?
So it's to look at it carefully and decide, okay, what will I balance? Will I balance altogether? Will I start with something? And in different phases. I like to do different phases. Not regarding the vitamins, but if I have to help, for example, regarding a certain type of unbalance, and I know that it could have an impact, for example, on the guts, maybe I will wait and say, okay, first, let's work on the balance of the guts and then rebalance something else. For example, if there is acne and problems with the guts, I like first to balance the microbiota and then maybe to address the acne. And I think that it's all depending also what comes with the blood test, right? And then create a personalized supplement plan with the different vitamins or minerals that are lacking. And that could be an upgrade for the patient. And I've experienced that each time the patient feels better. Of course, it's for a certain amount of time because then you don't want to overdo. Also, what you will give, which brand you will give, which amount you will give. I always like to look carefully which are the professional brands, how are the doses recommended, what would be the best doses also for recovering from a certain deficiency to a normal rate. So I think all this is it's a whole science, but also like a whole technique behind, and also like trust in brands and trust in controls that are done to these brands, and also how it impacts on the person, because each person can react different way also to supplements. So it's important. I would always suggest also to recontrol, and I always tell to my patient, even though they stay here with us like a certain amount of time, maybe to refresh afterwards and to make sure that we don't overdo. Like vitamin D, we know that can be toxic if it goes too high. We know that the B6 can also be toxic if it goes too high. So selenium also could be like damaging if it goes too high. So there are certain elements that we need to supervise, and we cannot just like take for lifelong and never control. And so this has to be controlled.
More is not always better when it comes to supplementation.
Exactly.
What are other myths around taking supplements?
Vitamin C is implicated in helping the immune system. That's true. But I won't say that taking always vitamin C would like always boost the energy. It will boost the energy if we need it, if it's low already. But if it's already good and you just overtake it, it won't like boost the energy. We need to be always careful of what we need, what are our real needs of the body. So, and I would suggest that, yes, we don't need to take them every day. Why not? If some days maybe we think we are a bit low in energy and we have a multivitamin, why not? Because it might be that it was a period of time we're not eating enough or not eating properly, and it could be that we are lacking. So that could be like for a quick fix. But I would suggest that in a regular base, that a good checkup to really target what is low, it's always best than just take whatever and overdo and then not really target what has to be targeted.
It's sometimes I see people, they just take supplementation just because they have read about it somewhere and it's recommended to take. But we've been talking a lot about it, and it should always be like based on a medical testing, and it should never replace real food, right? So you cannot just stop eating or eat purely processed food, and then on the other hand, you want to take supplementation to cover up.
Exactly, totally. I agree. The main base would be to have a proper diet. Make sure to have quality food. Regarding quantity, I think quantity is important, a certain amount. I like the healthy eating plate of Harvard as a reference. And I love to point out that it's important like to choose which food we take, the freshness of the foods. If we cannot buy fresh, maybe then buy frozen food that has been picked up and then frozen and the vitamins are conserved there. Certain foods could be looking fresh but maybe not so good in quality, and that could be where we lead to have then a deficiency. So all this together, of course, is important to look at, and how we cook also the food, and how it's if we cook and then we leave it for next day in the fridge and recook, how are the vitamins? Are they still there or not? It's important to think about all these little details that can affect the vitamin intake of the food that we are eating. Yes.
Yeah, there is also this term bioavailability of nutrition in our food, but also the capability of our body to absorb that nutrition or out of what we eat.
Totally. That could be two factors that really interfere with our intake of enough vitamins. So the bioavailability, of course, it has to be how it has been cultivated. If it has been maybe too quick or pick up before it's completely mature, and also like how it has been cultivated, where, in which condition, if it was really with the sun intake or not. I mean, it's like many parameters. And also if there is like a rotation in the soils where it's cultivated. And of course, the malabsorption can always be there when we have gut issues. And the important is to see how we can balance it, either through medication, to supplements, to different testing, to understand what's the real cause.
Yeah, but now we get back to the individual case. Where does someone live? If someone is living in Africa, or if someone living in Switzerland, may affect the absorption because the soil is different. It has been maladapted or malused with pesticides or monocultural effects.
Yes.
The individual case based on the microbiome is different, or inflammation in the body. So all this has effects, and every person needs to be looked at individually.
I totally agree. It's totally like this. There are so many factors that interfere with how we can absorb the vitamins. We have to see if it's possible that orally it's enough, or we need to use different ways to correct all this. But I think that the main indication for all this, it's always medical. It's always individualized, and it has always to be for a health purpose, and always to help the patient to be in a better place and in a better state and go back to a normal health. So that would be, yes, I think all the important fields to look at.
I think everyone who uses supplementation today want to be healthier, or at least have the idea of being healthier, doing something good for himself. So you can go to a drugstore and you can buy any type of supplement or vitamin or mineral out there. But I feel like it does not mean your body is absorbing this and that it's beneficial to you. So this factor is I think a huge topic.
I love it, Abdullah. Really, it's so important. This reminds me of a story of a patient. It was 2 years ago. She came desperate. She had her car full of supplements. And she said, I tried everything. I can't make it. I have 2 kids. I'm a young mom. I don't sleep well at night. I'm completely burned out, overwhelmed. I don't know where to start. So I told her, and she was a bit short in her budget. So I told her, let's be smart and focus and understand what's going on. What do you have as a symptom? How are your menstruation? She was completely overwhelmed by her menstruation. She had too much bleeding. She was bleeding so much each month. And her iron was super low. And I told her, did you ever test your vitamin K1? And she answered, no, what's the vitamin K1? And she said, I went to all the best specialists ever, and nobody told me about the K1. They are always focusing on the iron level. And I told her, yes, but if your K1 is not enough, then you might overbleed each month. And of course, if you overbleed and you lose so much blood, of course your iron will be low. And then she said, okay, let's try it. So we tried. The K1 was low. We corrected it. She was bleeding less. Then we did also the checkup of how was her fatty acid lipids ratio and composition and everything, because she was breastfeeding, having kids, and we know that the brain of the kid needs so much of these good fats to form his own brain. And I was telling her, if you were not paying attention of taking enough of this, when you were pregnant, when you were breastfeeding, of course the kid will take from you. And then we look at it. It was super low also. And then we were also correcting the iron, because at that moment it was low, but then it went back to normal. And then she was back to normal.
Yes.
Like in a very, very quick way.
I like that. And it shows also clearly that one figure, like one deficiency, doesn't mean that's the origin of our issues in our body. So we have to look at it more connected, and that's why you need know-how. That's why you need more than just nutritional or a drugstore with a supplement.
Totally. And I love to also educate the patient regarding, okay, be careful which brand you take, where you fulfill, where you make your storage too, because I mean, not every brand are controlled. And I heard a lot of things about the lack maybe of control of certain brands, especially in US or even in Canada. And it's my patient telling me about it. It's not even me looking at it. They tell me there is no control, not enough control. And I'm so happy that at least in Europe we have more controls about this, more certified brands and more professional brands, and also that our pharmacies are looking what they take in as a product, so that will also give extra like safety. So all this is very important.
Talking about nutrition and the latest techniques, everyone also, maybe obesity is a big topic worldwide. We know that. And lately, in the last years, there has been a new medication out there which focuses on the GLP-1.
Yes.
And what's your opinion on that? And how have you been using it with your patients? And when would you use it? What's your experience?
Thank you to ask. Yes, it's a big topic, and a lot of people are now looking at it as the solution for everything, especially overweight. So I would be very objective in the sense that I think it can really help some persons that really need it and that have been looking to doing everything carefully regarding the diet, regarding the sports, regarding like even
doing the basic things right.
Doing the basic things right and still struggling and still having overweight. And there are now GLP-1 that are really indicated just for overweight and for obesity and not for diabetes. And I have been seeing good results. And it really helps them also to have a switch, because as they feel better in their body, they are maybe like decreasing the intake of alcohol and wanting to even go better and do more sports and so on. And it motivates them. So I think this can be very positive. It can be not good for everybody. I had patients that had really bad experience with it. They couldn't eat anything. So although they needed it because they had diabetes, they had overweight, and they're being careful with the diet and the sport, but maybe not 100%, but that could have helped them to go to a next step, but they couldn't tolerate it.
How? What happened?
They couldn't eat anymore. Nothing. Vomiting all the time, even just water. So of course, this
big
is
side effect.
Big side effects. So this was a big contraindication of not using it. So in this case, I really think it's not possible to use it. And then there are other patients that think there is a solution for everything, but they won't be willing to do more sport or change their diet and just use this as a solution. So I think it has to be super clear. When we start this, it has been to be accompanied by a lifestyle change of how we eat, of life, of activity, of physical activity, and understand that we need also to take enough proteins so we don't lose muscle mass. Because imagine you lose a lot of weight, but you lose a lot of muscle.
Exactly.
And then you stop using it, and then you put back on weight.
Yes, but not the muscle mass, which helps you with your metabolism. Exactly.
So this is the risk of it. So there is a risk to lose muscle. So if I have patients using it, I'm always super careful to look at the body composition, to look at the muscle mass, to look at the fat mass, and to look that we are going to the right direction, make sure they're being careful with what they eat, with the physical activity, and that is indicated for them.
Okay, so if someone is using GLP-1 medication, it's recommended to do in parallel physical activities, muscle training, and some other...
And taking care of the protein intake. And yes.
I mean, protein, blood sugar. Blood sugar.
And you know what? I heard with the cardiologist that with who we collaborate, that he had a lot of patients with syncopes with this. I hadn't. But we had one patient that arrived to us lately, and she was onto this drug that has been prescribed to her online because she was wearing a coat, but she was actually underweight and she had a syncope.
Yes.
So actually, all these risks are there of doing syncope because we go too low in sugar, because we are not eating properly or not enough carbs. Carbs, hydrocarbonate have been a bit demonized, although there are carbs that we need. We really need carbs. Also, our brain needs carbs, but it depends when we eat them and which one we choose to eat. Of course, it has to be low glycemic index carbs. These are the best. But I really think that also we need to be careful of how many carbs we eat. And yes, intermittent fasting can be also risky. And this is like a kind of intermittent fasting and discontrol, unbalance, especially when it's not supervised. And it can happen, and it happened more and more. And we heard from this colleague that
I found it interesting with GLP-1. Yes, as you said, it can be misused. And I've seen also cases, unfortunately. And it can have even more side effects with people with underweight, like on their bone density and other issues we have been seeing. But also, how do you see the connection with the insulin resistance? How can it help there? And some other topics, if let's say someone uses the GLP-1 medication, are they lacking any nutrients because they stop eating, basically? I've just seen last weekend a friend couple, and both of them, they have lost, in the last couple of months, over 20 kilos each. And I was very surprised, but they feel better. They feel better in their body physically. He had like knee pain, and she had other issues, and this is gone because of less weight. But what about the biochemistry, the biochemical side of it? Does less eating lead also to deficiency in nutrients in our body?
Definitely. I have this same experience with patients with EGLP-1, and they had already in the past a tendency of certain deficiency that were always coming back. And in this case, it was even getting worse with this. So that's why it's super important to supervise. And in this case, I tell you, I have patients I supervise every 3 months. It's really needed. They need it. Because otherwise, they don't pay attention enough of themselves, and they have already like a certain tendency of having certain deficiencies. And this is very important. And I think if you don't eat enough, and especially if you don't take care of this quality and the proportion and the diversity of the nutrition, of course, there will be deficiencies, I'm sure, especially if you are eating less, but you didn't correct the nutrition at the base. I think this is, it's a pity, but it might happen, yes. Yeah. I would super recommend to double check even more all the nutrients, the micronutrients throughout the blood test when patients are taking EGLP-1.
Are there any specific nutrients you would have a look at more closely?
For sure, the protein levels, then all the amino acidograms, because it's for the muscle mass. Then look at the magnesium, because in general, when there is not enough intake of food, it can be a lack of magnesium. And for sure, look at the vitamins in general. Vitamin C could be low, and it's so important to the stress, to help the body for the stress management, for the inflammation. It's implicated in the immune system. It's implicated in so many reactions of the body. So I would really suggest that yes, they check at least this.
And do this regularly.
And do this regularly. Yes, every 2-3 months for sure.
Yes. I mentioned insulin.
And the electrolytes. Sorry, and the electrolytes.
Yes.
Yeah, because I've seen one of my patients, he does sports, taking it, but of course he feels a lot dizzy. So I remember once I was there after he did like a tennis training, and he was telling me, I feel dizzy. I said, come, we take our blood pressure, your blood pressure, and then we see. And he was low. I said, no, I mean, there is, of course, it's totally normal you have it low because you just sweat so much, lost so much electrolytes. So it's very important that each time you train, which is important, and which is one of the lifestyle change we want, that you take at least electrolytes and supervise electrolytes for sure.
Yes, a good point. I like that. I think electrolytes in general are a bit overseen. Yeah.
Yes.
You have a training in diabetes, and can you explain to us like the insulin resistance and the connection with the blood sugar and healthy carb versus what should someone eat today? Because you can also see out there a lot of information about, low carb, intermittent fasting to bring down the insulin levels and blood sugar level in our body, but also the keto diet, which is almost zero carb, but it's also not healthy for everyone. What's your experience on that?
So I really think we have to think in terms of what's happening inside of the body. What happens when we have insulin resistance? It's probably that the receptors of the insulin, they get already overwhelmed and they are not functioning so well as they were before. So the pancreas is secreting more and more insulin. And of course, when you secrete so much insulin, the insulin is a hormone that helps us to deal with the sugar levels and to store and put us in storage mode. So we will store even more. So this puts us in a loop of storing more and more fats. And of course, that's not what we want, because the more we have fat, the more we have insulin resistance. And also it can be measured with the OMA index, which measures like 2 different values, the insulin and another one. And this ratio really helps us to see if we are into this insulin resistance or not. And I think that if we have this insulin resistance, it's also like very important to see it with this blood test value, because then we know it's like an extra like alarm that says, okay, we have really to do something regarding this. And why not to help to reduce this insulin resistance through a different method? GLP-1 can be one method, metformin can be another method. It depends also what are the hemoglobin glycosylated values, right? What is already the medication on with the patient, what he's already taking, what has to be readjusted or not, because there are different also anti-diabetic orally one that we can also like see and adjust in depending what are the medical history, the hemoglobin value, glycosylated value, and also, of course, adapt the diet. I would suggest that if I remember looking at studies when I was looking into this keto diet. Is it healthy, not healthy? How long to do it, and so on. And I was looking to many studies on PubMed, and they were all telling that the best would be just to do it 15 days if we want to make it to make it and make it in a healthy way. Because if we do it more, first of all, it gives us deficiencies, because of course then there is certain food that we will not take and so on. So if you do it 15 days, it can be that it helps, it has a positive impact and not the negative impact of it. And what about the carbs? The carbs, they are carbs that have high levels of glycemic index that will increase the insulin secretion. If we have insulin resistance, it is not something that we want to do. We want to have low carb glycemic index that will make less secretion of insulin, and in a more gentle way, in a more soft way. And there are like quinoa cereals that does this, all these cereals that like buckwheat also, and all these whole grain cereals that will help to do this low in glycemic index. And I think this is really key to switch towards these cereals that will probably be more adjusted. And also be careful of how much the quantities again. It's all about quality, quantity, and how we compose our eating plates.
It's a big hype also on this measure devices for blood sugar. And do you think this is a healthy development? So everyone wants to know what's my blood sugar at any given time or after every meal. And is it really that accurate with the watches? And
I think so. You mean about the sensor?
The sensor is one. There are only watches.
The watches, I don't know about it. The sensor, it's really accurate.
Yeah.
But I wouldn't suggest to everyone. It's a needle in the arm. So, of course, I mean, there is also risk with needles in the arm. You can have infection, you can have inflammation, you can have anything. So, if
it's painful.
It's a bit painful also, to have something there. At least when you put it, it's not like the most comfortable, device to have, of course, and you have to change it.
Yes.
Every certain days you have to change it. So I think that is important to always see what is the benefit and what is the risk throughout everything. Have the balance. So if the benefit is there, because, for example, we have a patient, he's diabetic, his lifestyle is not super good. He has to be watching what is the impact of what he's eating on what he's on his sugar levels. And then, for example, what is the impact of a healthy lifestyle in his sugar level? And there, I think there is a big benefit regarding the risk. Of course, if someone is not diabetic, I'm not sure I see the point to use it.
Yes.
I think it's more targeted towards diabetic persons.
Yeah. So, because today it's been sold as like a lifestyle product. You see healthy people full of muscles, testing their blood sugar levels. But okay, I agree with you.
Yes, and this is another topic, but I think it's very important to understand, is it this muscle mass, has been built up in a natural way or not? And this is also something, because we see something on the picture, we see something on videos, we see something on Instagram, but what's behind the stage, This is also important. And I think it's all in terms of healthy and longevity. It's how we are going to manage to be healthy in the long term.
Yes. I mean, talking about lifestyle, what affects us a lot is stress in our life. And stress causes also something, release of cortisol. So what is this, and what kind of effect has it on our body? When is it healthy, and when is it too much and causes problems?
So, for example, the cortisol, the maximum peak, it's in the morning, and then it goes lower at night. So it's a hormone secreted by our suprarenals, just above the kidneys. And it's true that the suprarenals, they are stimulated by stress. When we are exposed to stress, we'll use cortisol as if we were pursued by a tiger behind us, and we had to run. And the cortisol will kind of protect to inflammation and this and that. But the problem is when this cortisol is released in a constant way, and then it has an impact on ourselves. It gives us, it could trigger anxiety and put us in a constant anxiety mode, as if we had the tiger always behind us. So what happened with the cortisol level? It can be measured in blood. It can be measured in saliva test. In saliva test, it would be 4 times a day to see what is the rate, if we are in the good ranges or not. In blood also, because normally we do it here at the Balance in the morning. And it helps us to see how is the cortisol level in the morning. And from that also, we know also what are the stress level of the person. Is he dealing with a lot of stress or not? And some person, they can come to us and they think they are not so stressful and they have cortisol to the roof. So this is a very good indicator to be objectivized, to say, yes, your stress, your body is feeling stress. We can see it in an objective way in a blood test. And this is something that helps them also to objectivize and see it, and be palpable. It's something palpable. And sometimes I say to my patient that what I like is to bring something palpable, something that they can really see, value, that we can see the evolution, see how it evolves, see how it decreases, see how we have worked on it. And this is for me very important, that the patient and me, both of us, we see the difference from the beginning to where we are. And it's important for me that it decreases, that we can work on it, that also the homocysteine, both of them are implicated into stress, that both of them decreases, that we go from one place to another place, and this other place brings us to more relaxed mode, more stability, less anxiety. And I think this is where we want all to go, to a better place.
Another big topic which affects a lot of people, of course, is women's and men's health in general, because it's not just a physiological, medical effect. It affects also mental health and families and partnerships and so on. Can you explain what are common problems with women and what are common problems with men, and how can they tackle the issues?
Yes, we know that in women, because they have this hormone that are cycling, they are not always at the same level. There is peaks of estrogen at the ovulation, peaks of progesterone just before the menstruation. And all this can have an impact on mental health also, on well-being. And sometimes it's overwhelming. Like premenstrual syndromes or PMDD or polycystic ovaries, they all have a certain impact in a different percentage. Of course, it's much more current to have premenstrual syndromes, although it's not all women experiencing it, than PMDD or than polycystic ovaries, But this can be also addressed in a very personal and individualized way, as there are many also studies showing what supplement can help, what medication can help, like metformin could help also in polycystic ovaries, and what supplements could help in premenstrual syndromes or PMDD syndromes. I think it's really important to also see the values at the beginning. What's wrong? I remember one of our late patient that had PMDD and was really invalidated by it. Like after the ovulation, the 15th next day was really tough, affecting her lifestyle, even her couple, her professional life, and that we could really, really help her so beautifully, like just rebalancing her tryptophan levels, her glycine levels, and all this with objectivized blood test results, and seeing and comparing, and also looking at the hormones. I remember that she came with a progesterone cream, thinking this was the solution, and I told her, no, you have to stop. It's way too much high, and especially at that moment of your period, at your cycle, you shouldn't have these levels. It's like even higher than the normal. And then we stopped this, and then we were retesting, and all these like changes really helped her, because then she was telling me, I can have a normal life after my ovulation. And that was a big shift and change for her. And I'm so happy we could find out what was the missing parts of this, and how we could explain this, and that she could understand. And now she's in a much better place for this.
Yeah, it's beautiful to see. I know that patient.
Yes.
When is the right time to do these testings in the cycle of menstruational cycle? So
it depends. When you do it, you have to know where is the cycle moment that you have been doing it, and also what you are looking for. So you could do it either at the beginning of the cycle, at the ovulation, or just before the menstruation, because this will give us a bit of an update of what are the hormones like, and if we are secretating enough estrogen or progesterone, because there is a fluctuation. And of course, seeing how is the brain also. The brain hormones, FSH and LH, has also an impact on the secretion of estrogen and progesterone. And I really think that this is also key to supervise, because then also we can diagnose maybe a premenopause, because if the FSH is going higher, then we know we are getting closer. So all this together are a super important indication, and it depends what we are looking for. It's not a specific moment, but it would be beginning of the cycle or in the middle of the cycle.
So it's not always clear when to test, actually.
No, it depends what we are looking at.
I see. You mentioned premenopause and menopause. Can you explain what happens exactly during this period, and how can women address their issues during this phase?
I think that it's a phase that women has to prepare, because we will all go through, and it's a different step in the life of a woman, and I think it's beautiful if it's well prepared. So, for example, we know that it affects the mucosa. So many women explain that after getting this menopause, they have dryness in the skin, in the vagina mucosa. They have difficulties to have intimate relationship. So all this impacts so deeply and so intimately in the women life, that I think it's so beautiful that we can address it. We can see how we can help. We can maybe again do blood tests, see what's lacking, what are the absorption, if there is a malabsorption or not. And I love one supplement that really supports the skin, supports all the mucosas. And I really have good feedbacks also regarding my experience as a physician that help women in this phase with sea buckhorn that is rich in omega-3, omega-6, omega-7, omega-9. And I think it's just beautiful to use it and see also the impact in the health of a woman, and how she can improve and get back to more hydrated skin, more hydrated mucosa. And of course, I mean, there is always the possibility of using also bioidentical hormones to have a follow-up, a proper follow-up, and see what is needed, what is not needed, who needs it, who can tolerate it, who don't tolerate it.
Yeah.
And also there are also supplements like bioflavonoids that helps also for this. And I think it's all about like always supervising also tumoral markers, because we know there is also like, we never know, there is always a risk, and why not to supervise it, especially at that age. And I think that it's beautiful to accompany the women in any stage, any age, and especially in that age when maybe they need support.
Yes.
Because there are a lot of changes in life happening. Supervise bone density, supervise the muscle mass, prepare maybe the step, doing more sport before, because they say it's more easy to build up muscle when we have the hormones than when we don't have so much hormones. So I would suggest that when we are 40s to 50, for sure we have to really be careful with the physical activity.
Yes.
So again, lifestyle is very important, how we eat. And especially at that age, maybe we absorb less, so maybe we have to adjust what we are eating. It's maybe not the same than where we were in the 40s. So some little adjustment can be done,
Yes.
of course. And I think each stage is super beautiful. So it's like a flower in different steps.
And probably also get psychological support, help through that phase if it gets more
Totally
intense. Also,
it
the
can
emotional imbalances affecting relationships, families, right?
This is totally needed. I really think it's key to have support in any field, as everything is complementary. One thing is what's happening in the biological part, and one thing is what's happening in the emotional part. And we are one human being with all this together. And I think it's really important to always think in terms of an holistic way and a comprehensive way.
Good. Well, what about men?
Yes,
so they have also...
They have a big
issues.
big issues also, but big part to play. They also struggle sometimes with testosterone. I've seen also quite a lot of my patient male that struggle with testosterone level. And I always encourage them to make sure we go back on track, but try always like looking first more to the lifestyle changes, what we can change here. Also to avoid toxic substances that could be also playing a role there.
Yes.
I've seen quite a few of my patients that were taking drugs and then having impacts. It was better. They were taking back. We were like really with bad levels. So I really saw that it has an impact, a direct impact. I think it's bad for many reasons, but one of the reasons would be the testosterone levels. And I think that this can be also like corrected throughout supplements. I've looked studies saying that ashwagandha helps, that ginger helps. So the vitamin D is also important, plays an important role regarding the testosterone levels. Of course, the physical activity, the sleep, and the stress levels. All this together has a big impact on the male health. And I think when we have been doing all this, if we are still struggling, then why not to give testosterone injection? But I really encourage them first to try
natural ways,
life change style, avoid toxic substances that could be affecting. And if really we are still in a bad place, then of course there is always the way to supplement.
Another big topic is for men, especially erectile dysfunction, which clearly doesn't just affect the man himself. It's the partnership, it's the family, and a lot about emotional level, feeling not whole. And what's your experience with patients?
I think it's so important to address it. I think it's so important that the patient knows that he can talk about it, that he feels sustained, that he also could understand what's the deep root cause of it, that it could be emotional also. And of course, many times they address it to me because first they always say, oh, I feel shame. And I think I'm always trying to put them at ease and say, it's totally fine. I'm super happy that you come with this topic with me, because it means you have confidence in me. You can feel that I could support you. You can feel that we can find a solution together. And of course, they always ask for medication that would support them. So in the first stage, I always tell them about the side effect, that they have to let me know if they have any of the side effects and how to use it and when to use it. And I always start with the lowest doses.
What are the latest medications to use?
Like sildenafil, for example.
Okay.
That could be one. In general, I use this one, and it works really good. Then there are other ones, but there are even ones that are aggressive, like even injection. But this is another topic. And but I think that what's really important is that we find out at the end what's the root cause, what's happening, why he's having this. Is it really organic? Many times it's not. It's emotional. Sometimes it can be organic, of course. But I think that if there is an emotional component of this, it's important that it's addressed, that we found out what is behind this, what's happening, and that it could be sorted out just because of emotional part, maybe stress related, maybe some couple problems, maybe it's something more personal. I mean, it's always something in the story of the patient, very often, maybe not 100%, but very, very often.
Yes, or it can get to a cycle, you know? It can start 1, 2, 3 times, and then the emotional side, then your brain kicks in.
Yes.
And then finally, it's difficult to get out of this vicious cycle.
Totally. I remember patients telling me that they went in a loop and they were even very young and had no reason to have problems for erectile dysfunction at all. And they were in a loop, and to go out of this loop, that's why I'm happy to give medication. And when they are out also, or not completely out because they are still taking this medication, then to address the emotional part of it, so we can be sure that we are covering all the areas and that they are also feeling heard. And I think it's so important.
I mean, medicine is moving fast. We know that. And more specializations are coming up. There is ChatGPT and other AI. Will your job be gone in a couple of years?
I think medical profession is an art. I think it's so personal. I think AI we can always use because it helps us maybe to find better, quicker, maybe scientific articles, or like have a quick overview of certain topics and then research more deeply. So far, I think it has an impact, and why not to use the positive part of it? But also, when I look at it, sometimes I also, with my background, feel like there is a lot of lack, a lot of like, you have to see it with critical eyes again. You have to say, okay, what's really right, what's really wrong. And if you don't know anything, you would just trust everything or think everything is right, but without criterias. And I think we really need to have criterias regarding this. And I think the role of the doctor might be also, again, to educate the patient and say, this is right, this might not be right. Yes, why not, if there is a suggestion, why not to explore it if we didn't had the idea about it before? But I think the human mind to treat another human would be always the best solution, as we have this empathy, we have this contact, we have also this trust, we have also the relationship that we create. I'm not sure if I was a patient and I had to be treated by an AI, I would be like confident in this.
Yes and no. I mean, if someone is trained like you, and I can trust, certainly, if you are somewhere, let's say use cases, you are somewhere in the desert and you need some medical support in that moment. So there are always use cases, and AI is developing so quick. I tried one thing by myself. For example, there is this possibility you can create like a custom AI assistant. And I created a custom AI assistant which has all my medical data, more my medical information, blood results, gene tests, heavy metal tests, everything we have been doing basically, even supplementation plan, I uploaded to that to give it substance about who I am, what I'm struggling with, my history, but you need to give AI the right information. And then you can ask information. Simple. Is avocado good for me? Just as instead of maybe a pre-step to getting to a doctor.
Yes, I understand.
Especially for people who want to improve their lifestyle, improve their life, or maybe these AI solutions can be in a way to remind someone more individualized on their cases. So what I want to say is AI can certainly today is not up to that level, but it's moving so quick and it's moving in a direction where it can be very individualized on my personal needs. Just so.
I mean, it's good to stay open to the possibility of a collaboration. Why not? Even to support a doctor. Why not? I think the future is unpredictable, but I like to say that whatever can help for a better health of the patient, whatever can be a support that is intelligent and reliable on, and we know the limits. I think that it's all about knowing what are the limits of the system, then why not to use it? But yes, I think it's always also, again, like risks and benefits are always to be looked at. And I mean, I like to see the future as a new challenge, also regarding my profession. And I'm also someone that likes to adapt to new situation, new conditions. And if it can be for better of the patient, of the professional, and of the general well-being, why not? Yeah.
The future will show us where this is going to. Thank you so much.
Thank you.
I have one more question to you.
Yes.
And it's about if you would speak to all our listeners or everyone in the world, what would you give them? What would you tell them now?
I would definitively tell them to listen to their body, listen to their feelings, listen to their emotion, and try to find someone to help them if there is any imbalance that they feel, a professional one, professional doctor, psychologist, psychiatrist, to look and dive deep into their biochemistry, see if there is any imbalance, try to maintain a mind healthy state with meditation, do their sports as much as they can, try to find someone some sports that they love. I think it's all about also when we want to increase or improve something in life, it's not only about thinking, oh, I must do this, but because I love myself, I want to improve this or this. And I think regarding if we shift this as from a loving place, I think this is a really powerful way also to make changes in life. And I would suggest that this is like very, very beautiful to start a new journey, start changes, start lifestyle. And I would love to also tell to the listeners that we are always here to help. And so if they feel that we can be there to help them, we are here and they can come to us.
Beautiful. Thank you so much. I know the great work you do and the results you have been achieving. And I want to thank you for that.
Thank you so much, Abdullah. Yes, I like so much our collaboration, and I think you are a bridge in between the patient and us. and that help them to find a solution when they are sometimes struggling in difficult times, situation, emotional difficulties. And that is beautiful. It's a beautiful bridge. Thank you so much.
Thank you.